Yeah, I mean this is an ultrasound study of the postpartum female. He gave birth to a baby 22 days back by operation, by cesarean section in some hospital. And this, but the area that you are seeing is the uterus in longitudinal section, measuring 11.1 into 4.3 centimeters, with this being the endometrial canal at the cervical region. This is the cervix. This area is the cervix. This is the anterior myometrium, the posterior myometrium. It does show decreased echogenicity postpartum. Now, the outer surface is smooth. The fundal region is okay, and the posterior wall is also showing no focal lesion or calcification. However, this approximately measuring 20.1 millimeter echogenic area within the endometrial canal is very much consistent with RPOC. This is an RPOC, this area, and otherwise the cervix is normal. No fluid is seen in longitudinal section of the uterus. This is the longitudinal section of the uterus, this being the cervix, this being the lower segment of the uterus, upper segment, the fundus, and you are seeing the RPOC as well. Okay, now on transfer section, this is the transfer section of the uterus, and we do see echogenic areas interspread within the endometrial canal. Now if you see that this region is the endometrial canal, it is though not dilated too much, but these echogenicities and the debris, this echogenicity, these tiny echogenicities, these are very much consistent with the RPOCs, and the uterus measures 7.3 centimeters. Postpartum uterus usually is unlike 20 days postpartum uterus. So you see that there are multiple linear tiny areas within the endometrial canal that are consistent with RPOCs. Here you can see there are this echogenicity. So there are RPOCs in this postpartum uterus. This is the RPOC. These echogenic areas with no shadowing. Now in this same patient, as the history is that of persistent vomiting, bleeding for vagina, fever with rigors. When I move the probe towards the spleen and left kidney, I see that both are normal. The spleen is normal, the left kidney is normal, but as I come downward, straight down, I see a fluid pocket anterior to the left iliopsoas muscle. This is the left iliopsoas muscle. This strap of muscle is the left iliopsoas muscle. This is the fluid pocket. See, this is the posterior wall enhancement from this fluid pocket that has internal debris, multiple septa within it. However, no calcifications are seen, and this is either a fluid fraction, either an abscess or a bleed in the region of the left Colic region, and it measures approximately 9.7 by 6.8 I will say 10 into 7 centimeters, and the volume of this cystic area is approximately that this is the longitudinal section, and this is the transverse section. So calculated by the machine, this collection of populated fluid pocket with internal septations and debris has an approximate volume of 263 cc or 263 ml. However, when it is going to be during surgical intervention, the amount will be more than what I am showing you here. It will not be 263, rather it will exceed somewhere about 300 cc. Note the posterior wall acoustic enhancement in both cases. This is the longitudinal section of this cystic area, cystic mass, and this is the transverse section of the cystic area with internal septa, debris layered out with the posterior wall, anterior portion being normal. And it tracks down. It is walled off, as we do not see its extension in the pelvic cavity. Here we come into the pelvic cavity. This is the uterus. Again, in view, a longitudinal section. Here I am going upwards, and we see the fluid collection in the left paracolic gutter. As you see, this is the strap of muscle called the iliopsoas muscle. This is populated cystic area. So this is a case of a postpartum female with Rpocs as well as with a loculated fluid pocket in the left paracolic gutter, having a volume of approximately 300 cc. Rest of the ultrasound is unremarkable. Thank you.